Good morning, everyone out there enjoying your, what is today, Sunday morning with me. This is part of we try to make it monthly webinar series of really just free education that I do because I love to teach and I want people to understand the reasoning and the scientific rationale behind why I have gotten into natural medicine and why I have this line of supplements to help people regain their health and empower themselves really against the onslaught of pollution, toxins, bad food, mental stress of our modern lives. I've long thought that the core of orthopedic conditions is the same thing that's the core of most chronic non-communicable diseases, things like cancer, diabetes, stroke, hypertension, autoimmune disorders, etc. It's really just a fundamental cellular dysfunction at the mitochondrial level where you have too much inflammation, too much oxidative stress. So inflammation, it's easy to say inflammation, it's easy to say too much inflammation, acute inflammation, chronic inflammation, but a lot of times we forget about what inflammation actually is. So this is sort of a review, a reprise of a talk we gave before, but I've changed it up a lot and added a couple things. I'm just going to really talk about inflammation and why it matters and how you can fight back. Okay, I just love looking at pictures of myself. Next slide.
What about new guests?
Okay, this is me. I'm Dr. Meredith Warner, founder of the Well Theory, which is my way to get natural products to you guys. I also invented the Healing Soul, which is how I got on this journey of natural medicine, because it's a flip-flop I designed to treat foot pain naturally. It works really, really well. That aside, I'm also a practicing orthopedic surgeon and I teach for LSU. So I'm in Baton Rouge and New Orleans every week. What is inflammation? So we're going to discuss the basics of the immune system and how inflammation is really just part of the immune system. What is the function of the immune system? How does it really target infection or injury and clean it up? And that kind of gives you a clue of the function of the immune system right there. And then prostaglandins, how they play into inflammation. What is chronic low-grade inflammation? Because I talk about that a lot. And how does chronic inflammation affect the body? And why does any of this matter to you or matter for disease? So the immune system, and by the way, if anybody out there is an immunologist, I apologize. I'm going to keep this very simple. The immune system is basically an innate and an adaptive system. So think of it as your first line of defense, your second line of defense. So the innate is what's there. It's always there. It's always circulating. It's always ready to go. It's non-specific. If it just senses anything that is non-self, such as a pathogen, or if it senses anything that is damaged self, such as injured tissue, the innate system is going to come in. Again, no specificity, first line of defense. It recognizes patterns. So there's actually things on the cell receptors of the innate system that recognize molecular patterns that are released by pathogens, things like viruses and bacteria. And then also damaged tissues release certain molecules that signal to the innate immune system and bring it in to begin the cleanup process. So there's constant surveillance with the innate system, circulating mediators. Mediators, just a fancy word for the different little items and products, the cytokines and the white blood cells that are floating around as part of the innate system, okay? They're always there. They're always ready to go. They just get a little bit of a signal. They act. That's your innate system. The adaptive system is a second line of defense, okay? This is very specific. It's not non-specific. So it's specific to particular types of badness. It will recognize pathogens. This is when you say that you have a good immune system, or, oh, trigger your immune system, or, oh, I need to develop my immune system. Excuse me. The adaptive system will recognize, let's say, you got a cold this flu season, you're not going to get it again because your adaptive system is going to create B cells and antibodies that are specific to that particular virus. And if that virus ever enters your system again, you're going to shut it down immediately and get rid of it. It's a direct attack of molecules, and it uses sort of like a receptor system. So there's antigens, which are off of the bad guys, the viruses and the bacteria. The antigens lock onto a receptor, and then you get triggering of the adaptive immune system. Again, kind of a simplification. But these two work together all the time, innate and adaptive. It's kind of a very elegant system if you think about it. We always have a first line of defense for the unrecognizable viruses or viruses that have mutated or bacteria that have mutated. But then we have an adaptive system that can come in and actually give a much stronger, quicker response the second time it sees any one given organism. And that's how vaccines work. They train the adaptive system. Next slide. Okay, so you've got the innate and the adaptive. You've also got acute and chronic inflammation. You don't want to not be able to produce inflammation. If you didn't have that capacity, we would really have no immune system, and that wouldn't work out well for life. So the acute system is necessary. It's defense against invaders. It helps to clean up injury immediately, get rid of the dead cells, the damaged mitochondria, the proteins that have folded improperly. It's able to recycle and repurpose proteins. So the acute system is extremely valuable, really, to how you function. Anytime that, like, let's say you tore some muscle, you were training for something and you overlifted and you ripped some muscle tissue at the microscopic level. Well, what is your body going to do with that damaged, ripped cell membrane, the proteins that are messed up, things spilling out into the tissue fluids? It's going to trigger the innate system that's going to come in and clean up all that debris and then trigger a repair system to come in and fix it. And you'll get back to balance, or homeostasis is our fancy word for balance. Chronic inflammation, on the other hand, is totally unnecessary. It is mostly triggered by lifestyle and environment, foods that we eat, things like that. And it'll actually end up damaging good tissue. So it isn't really specific to bad tissue. It doesn't even care. It'll just start damaging everything. And it'll create senescent cells. It'll send out damage-associated molecular patterns to make it look like all the tissue is damaged, and you just start self-attacking at a low level all the time. So it's just like, death by 1,000 cuts over time. Little tiny paper cuts, get enough of them, you could bleed out. That's what chronic low-grade inflammation is doing to you. There's absolutely no point to it whatsoever, but it is triggered with our modern lifestyles. It's something that never existed before, but we have created it with things like adiposity, pollution, environmental toxins, food dyes, things like that. So you want acute inflammation because it's short-term, it's necessary. It serves a purpose. You don't want chronic because it's long-term, it's unnecessary, and it serves no purpose. So inflammation has historically been part of the reason that most of us died off. So most humans in the past died off because of infection, because of transmissible or communicable diseases. This is the plague. That's that beak-like symbol is how people kind of represents the plague invading. Plague was brought about by fleas, not ticks. Fleas that would give this particular pathogen. It killed, really, I want to say, at least half of the European population. Like, it was massively devastating. And that's what typically killed off people. That doesn't really happen in the modern world anymore. We're not killed off by pathogens anymore like the plague. But what would happen is it would trigger an acute traditional inflammation system. And I put a picture of these oranges here to show you a traditional method of treating the plague. It was found that cloves and orange rinds had naturally antimicrobial properties. Clove is known to, I think it has eugenol and a couple other phytochemicals in it, or flavonoids, which we'll talk about later. But clove is very, very antimicrobial and antibacterial. So a lot of your natural cleaning products should or might have clove in them, and clove would be used to scent a room at the time of the plague in the hopes that it would ward off the disease. Now, probably if they were wiping down their surfaces with clove, they were onto something, but I'm not sure just making the room smell good worked as well, unless it was cleaning the nostrils of bacteria through the volatile compounds. But I wanted you to just have a picture in your mind of what used to kill all of us off. And it was because of infection, which triggered the acute inflammation system. Now, of course, obviously, some of these infections made it past our immune system and we didn't survive. Thus, the massive death toll of the plague, things like cholera, the flu of 1918, things like that. But because of this, leaders at the time recognized it. The whole concept of public health was advanced. And then we began things like immunization, pasteurization, antibiotics were invented, and of course by accident. And then, we have more and more antibiotics. One of our biggest problems today is antibiotic resistant organisms, and nobody's making new antibiotics because there's no economic viability in creating a new antibiotic anymore. So that's kind of a problem right now. Hopefully, with all of the new technology we have that's going to make drug creation better, that'll get fixed. But this was the whole point of the inflammation and immune system, was to protect us from things like the plague. So we had diseases of infection or pathogens. Now we have diseases of civilization. So developed economies like America, we have higher rates of heart disease, cancer, diabetes, respiratory problems, things like that, than undeveloped countries, okay? Still in undeveloped countries, the biggest reason to die is things like malaria and cholera and things like that. So they're still in that world of dying from infections. They haven't gotten to the point where they're dying of non-communicable diseases, mostly because you're wrecking your own body with all of these toxins, pollutions, excess energy storage, et cetera. So these are called non-communicable diseases. You can't catch them from somebody else, like you can potentially catch a disease from somebody else or something, like a mosquito or a flea or a tick. But you get it from altering the metabolic system and the way your mitochondria function. Non-communicable, very lasting, very long-term, highly linked to low-grade chronic inflammation. And so that's what we're going to talk about. So the burden of disease, 70% of our diseases now are non-communicable diseases, and the rates are rising in places like China and Mexico, where they're starting to have a bigger and bigger middle class and a little bit more economic viability. As economies develop and societies develop, the rates of these non-communicable diseases rise as well, while meanwhile the rates of infection and death from infection are lowering. So the immune system's still present in all of these developed and undeveloped societies. It's just being hijacked in the developed societies in a bad way, and it's still functioning in a good way in the undeveloped societies, but oftentimes the diseases are just so overwhelming. In the early 1990s, that's how young this science is of us understanding chronic low-grade inflammation. Unrecognized, unuseful, meaningless inflammation was discovered by this seminal paper in 1993, Hota-Misligil. I'm probably butchering that. But that's when we started to recognize that there was a form of inflammation that was chronic, long-term, low-grade, and there really didn't seem to be a reason for it. This is just some foundational work. I just put this here only so that you know there's a ton of literature behind this and a lot of work that's been done. Most of it started in trying to figure out why people were dying from heart disease at such high rates. And we figured out that the plaquing that happens in the aorta and the coronary arteries that triggered heart attacks and then stroke and things like that, the cholesterol lining that would fill it from the too much LDL or lipids would get inflamed, irritated, and then pieces would break off, and that caused problems. So most of this work started there. So that paper I told you about in 1993, the title is Adipose Expression of Tumor Necrosis Factor Alpha. That's TNF alpha. That's one of the cytokines that's very, very important in the inflammation system that we're going to talk about. Direct role in obesity-linked insulin. And then another paper, The Pathogenesis of Atherosclerosis, a Perspective for the 1990s, all about cytokines and inflammation. Another one, Beyond Cholesterol, modifications of low-density lipoprotein that increase its atherogenicity. What that means is they're talking about when LDL becomes oxidized LDL, and then it becomes highly inflammatory, and so on and so forth. So all of this understanding began in the 90s, and it started because they were trying to really understand heart disease. So metaflammation, this is one of the things we figured out. This is sort of system-wide inflammation, and a lot of it is produced by adipose tissue, so fat. And I tell my patients to come in and think that their knees hurt or their ankles hurt or their hands hurt because of wear and tear, and then often they are told by other doctors that they're just too heavy, that they're overloading their joints, they're carrying around too much weight. Well, that's not necessarily the actual reason that fat causes joint pain, it's because fat is constantly producing inflammation or adipokines, cytokines derived of adipose tissue. This is how we are able to connect metabolism to inflammation. It is through the cytokines produced by the excess energy, the adipose tissue. It is a dysregulated system. It is a maladapted system. So this is what I mean by hijacked immune system. The immune system has been wrecked by altered metabolism. This is when you get prolonged and chronic low-grade inflammation all the time. When you have too much sugar hanging around, too many lipids hanging around, dysregulated mitochondria, nothing's quite working right. You get all this excess energy storage, and the fat cells just continually produce adipokines that then go and attack tissue, damage mitochondria, create more damage signals, and it becomes a self-perpetuating cycle. Nothing resolves it. You have to get to the fundamental source of the cause of the inflammation, or you have to directly counteract the oxidative stress with antioxidants. So metaflammation and adipose-derived adipokines. Just remember that. So just quick review. We have the innate and the adaptive. How do they work together? The innate system is comprised of barriers. So think of like skin and mucous membranes, things like that, blinking. All of that's part of your innate immune system. Eyelashes even. The cilia and the hairs in your ear and your nose. Organs, some organs are more important, like the thymus and the spleen, etc. Cells, all the white blood cells, neutrophils, monocytes, mast cells, macrophages, dendritic cells, B cells, T cells, okay? The complement system, which we'll talk about briefly, and then cytokines, which is why inflammation makes you feel like crap. So the innate system is your physical barriers. This is sort of your wall against badness that protects you. It is the actual physical defense mechanism. There are cellular components and there's the complement system. So your skin is probably one of the best examples of part of the innate immune system. Not only is your skin a barrier, but there's actually circulating immune cells in the skin. So we're constantly being surveilled and protected. The complement system we'll talk about a little bit more detail, I think, in the next few slides. So the physical barriers, we talked about it. The bottom left that looks like shingles on a roof, that's an electron micrograph of the stratum corneum. That is the outer barrier layer of your skin. So they really are like shingles, essentially dead skin cells that lay on top of each other and form sort of this protective layer. That is what you're constantly shedding all of the time. If anybody out there has ever had a cast or had to wear a splint for a long time and you take it off, you notice you have a lot of dead skin and callus built up. That's because you couldn't shed the stratum corneum like you do on an ongoing basis. This is why it's important to clean your house all the time too, because everybody that's in your house is constantly shedding skin cells all of the time. And you want to kind of get rid of those, obviously. So your skin. In addition, you've got the lining of your digestive tract similarly, okay? So your gut is lined not just with immune cells, but with roving immunoglobulins and things like that to protect you. Cilia. So when you cough and like when you're sick and you just have this sense of mucus coming up, it is coming up because the cilia, these little hair-like tendrils off of the cells, are pushing mucus and trying to get rid of the pathogens that have been trapped in it, and then the membranes. So we have a very elaborate wall system to protect us physically from damage. This top right, if you can see it, and I don't know how big it shows up on your computer, the top left of that 4-block square is normal mucous membrane cilia, and then the bottom right is that of a smoker. So this is one of the reasons smokers have such deep, loud, thick, heavy-sounding coughs, is because they basically have destroyed all of their cilia. So they've destroyed one of their primary innate defense systems against invasion by bacteria and viruses. On fat, we have a question.
I assume that all fat cells produce cytokines, right? Only the damaged fat cells from excess stored energy? And how does excess stored energy damage the cell? Thank you.
Okay, that question could be its own talk. They want to know if all fat cells produce cytokines or not, and then how does excess energy damage a cell? We've talked about that before in the talk on oxidative stress and in another inflammation talk. Effectively, if you have too much excess energy, your mitochondria are overloaded. They're constantly producing. They produce too many reactive oxygen species. The reactive oxygen species go on to create oxidative stress and damage. They destroy the mitochondria, the DNA, the proteins in the cell membrane of any given cell. In addition, your AMPK is dysregulated and downregulated, and then you never go into a fat burning state. And then you have circulating glucose in the blood, which then goes on to create advanced glycation end products. There's a million different ways having too much energy in the system causes cellular damage. And in answer to the other question, I think only brown fat cells don't produce adipokines. Pretty sure all adipose cells produce adipokines. Now, the damaged adipose cells, the ones that are in the center of like a big mass of fat that start to get more and more fibrotic and damaged, will produce more, but they're also producing damaged associated molecular patterns, which we'll talk about. But basically, yes, excess energy stored as fat will produce inflammation all the time, generally speaking.
And excess energy always means fat.
Yes. Okay. So this is something I try to tell all.
I think they can hear me.
Oh. Oh, you wanted me to say that. Oh. And when I say excess energy storage, what I'm saying is when you store excess energy in the form of white fat on your body. All right. Why do you hurt when you have infection, and why do people that have chronic low-grade infections seem to always have achy joints, arthritis, damaged tendons, things don't work right, weaker, bones don't work right? The reason is most of the white blood cells of the immune system and a lot of the innate immune system are circulating and harbored in connective tissue. Your body is connected by fascia that is in all different planes and different types of fascia. There's reticular fascia, which is very filmy and flimsy. There's fascial bands that connect the occiput, the back of your skull, all the way to the plantar fascia. There's fascia that's around every muscle. There's fascia around every muscle compartment. There's fascia in your tendons and ligaments, okay? All of this is connective tissue, and the connective tissue is where you'll find macrophages just waiting and hanging out, waiting to be signaled to work, B cells, T cells, neutrophils, the complement system, they're all in your connective tissue just waiting to be activated. And so if you have something going on that signals an activation or triggers it, like if you're producing, let's say, too much TNF alpha, you have rheumatoid arthritis or whatever, then you're going to turn all this on and your connective tissue is going to feel it. And I think this is why joints and muscles hurt so much, why we get so stiff and creaky if we have too much chronic inflammation.
Quick question.
Another question.
Can inflammation cause tinnitus? Tinnitus?
Tinnitus. Somebody wants to know if inflammation can cause tinnitus, which is like ringing in the ears. I think there is a component of inflammation and oxidative stress damaging the cilia and the cochlear bones. Gosh, the hammer, the anvil, and there's one other. And then causing this constant ringing. It is triggered by inflammation sometimes, but also some drugs do it, like some antibiotics will do it. And then, of course, if you're around loud noises all the time, and basically the mechanism whereby the cells respond to sound waves gets altered. But yeah, tinnitus, I think, does have an inflammatory component in some theories of its cause. Next.
Can inflammation cause trigger finger or carpal tunnel?
Oh my God. Can inflammation cause trigger finger or carpal tunnel? Yes. 100%. Because the connective tissues get too thick. Okay, the complement system. This is like way too complicated to even go into. I'm just going to brush over it. This amplifies and coordinates the overall immune system. This is a group of proteins just hanging out, circulating in your system all of the time. They are constantly active. They are surveilling you at any given moment. They are like the CCTV camera system in London. They're always on, they're always looking, and they're always going to produce a quick response if they see something they don't like. So there's different ways to trigger it, the classical pathway, the alternative pathway, and then lectins. The classical pathway is when the complement system, part of the innate system, is turned on by the adaptive system, antibodies. So this is how we can respond very, very quickly when faced with a pathogen we've seen before. The antibody recognizes it, turns on the complement, and the complement system just comes in and crushes it. But damage-associated molecular patterns and pathogen-associated molecular patterns can also turn on the complement system. So this is one of your innate first-line defense systems, and there are a bunch of these proteins hanging around. Does the complement system do this? So there's different ways it does it. Opsonization, chemotaxis, cell lysis, inflammation. So opsonization is basically phagocytosis. That is when it just comes in and coats the pathogen and allows it to be engulfed, brought into a cell that will then destroy it. Chemotaxis, this is when the complement system sends out little communication proteins to attract in the other immune cells that are going to do more work. So it's going to bring in your lymphocytes, your monocytes, your macrophages, your neutrophils. So those are like the Paul Revere's of the system. They're going to take the horse out, go get the rest of the troops and bring them back in. Cell lysis is direct destruction of pathogens. These complements will go glom onto the bacteria and actually drill a hole effectively in the cell membrane of the bacteria and allow the pH to change in the bacteria and allow different toxins in and kill the bacteria that way. So basically, our complement system will destroy the cell membrane, which is the bacteria's innate defense system. And then, of course, the complement system will induce more inflammation because it's going to trigger the immune system to get active in wherever that site is that's being infected. The adaptive system is your B cells and your T cells. The B cells make antibodies, and then the T cells will directly damage pathogens. So that's cell-mediated immunity. And they're also coordinating. So there's T regulatory or Treg cells. So the T cells and the B cells work together as the adaptive system. So the first, this graph just sort of shows you how this happens. The y-axis, the upright axis, is the amount of antibodies. The x-axis, the horizontal axis, is the days after you're exposed to whatever the pathogen is, which we call the antigen. So the first exposure, you don't have any antibodies. Then all of a sudden you have a lot, usually IgG, IgM. The second exposure, notice how that curve is so much higher. And actually the slope is slightly faster too. So you get more antibodies quicker on the second exposure. That's why we can live in a world where we're basically swimming in viruses and bacteria and not always get sick. Because we do have, believe it or not, our own immune system that is built to recognize and create antibodies to these things. So the antibodies, the IgGs, the IgAs, the IgM, the IgE, the IgD, these are immunoglobulins. And they're formed of a heavy chain, which is like the legs, and then light chains. And that Ig immunoglobulin is what attaches to the antigen. So think of that like the lock, I guess, and then the antigen's the key. The antigen being whatever signal off of the bad guy that they recognize. IgG represents long-term immunity. IgM is the first one produced. So that usually shows us that there's like an acute immunity going on, and that'll activate the complement system. IgA is found in the secretions and protects mucous membranes. IgA is one of the ways breast milk allows babies to develop an immune system right away. IgE comes out with allergic reactions, and then IgD is on the surface of B cells and will actually signal to other B cells to make more antibodies. So all of these are important, and they all work in a very coordinated fashion. Okay. So the B cells, this little cartoon, it says, I attack invaders outside of the cells. The T cells say, I attack infected cells. So the B cells are trying to catch the invaders before they get into a cell. If they happen to make it into a cell, the T cells are going to attack that damaged cell and take it out. So it's going to take out a self cell that has been damaged and turned into a non-self cell. So there's lymphocytes, B cells, T cells. Neutrophils are your white blood cells that are going to be the first to respond. They phagocytize pathogens and come in and eat them up and clean out debris. And they're our most common. So like if you do a CBC differentiated, if you ever see that blood work, and then you'll see the percentage of neutrophils, lymphocytes, monocytes, the neutrophils should always be the highest percentage in most cases. That is your most common white blood cell. And then we've got the monocytes and macrophages. The macrophages are functional in both systems, innate and adaptive. The macrophages really bring in a lot of the debris cleanup and also help send out chemotaxis signals, and then also help with the repair phase. So what organs are involved in your immune system? Well, the bone marrow is important. That's where a lot of white blood cells are produced. The thymus is where T cells mature and become functional and trained, like they learn how to recognize infected cells. Lymph nodes, you know, when you felt like a lump on your neck when you're sick, or like in your groin when you have an infection or a surgery on your leg or whatever. The lymph nodes are throughout the body. There's certain ones that get to be bigger than others. Those are ones we usually feel and that hurt when we're sick. And they filter lymph fluid and trap pathogens as well. These are throughout the body. And then you have lymph circulation throughout the body that helps get rid of fluid that has become, it's like the sewer system, I guess. It's like the fluid of the lymph system traps and collects debris, damaged cells, pathogens, old cells that have been infected by pathogens, whatever. They go to the lymph nodes, then they get out of the system if you have a functioning lymph system. The spleen in your upper left abdomen, it filters blood, stores white blood cells, and this is where a lot of your antibodies are produced. So this is why if somebody's asplenic, like if somebody has a car accident and they lose their spleen and they become asplenic, their immune system is not as strong as it could be before that. So the spleen is very, very important for immune function. So not only do you have cells running around in the complement and all of the barriers, but you've got a bunch of organs involved too. So obviously the human body was evolved, designed, whatever, meant to be in a world surrounded by pathogens because we have a very, very strong system for handling it. The lymph system is named after Lympha, the deity of fresh water. Again, it's formed of vessels, nodes, your lymph nodes, the organs, the thymus, the spleen we talked about, tissue and lymph fluid. You process about 20 liters of blood daily, okay? Processing through everything, you know, the kidney, everything else in your body. 17 liters are returned to the heart in blood vessels. So your heart pumps out 20 liters, 17 liters are going to go back by way of the veins. The 3 liters that are left go into your tissue. And the only way they can get back is by the lymph system. So think about it. If you have a messed up lymph system, you've got about 3 liters a day that have nowhere to go. Now, generally, the entire lymph system doesn't go down at once. It's usually one area or another. For instance, a lot of women that have had to have sentinel lymph node biopsies after breast cancer surgery, the lymph system to whatever that arm is will be damaged. And that's why you'll see some women with really large arms. It's because the lymph system of that arm is not functioning, and therefore all of that tissue that's supposed to come, fluid that's supposed to come back through the lymph system can't, and it just collects and hangs out in the arm. So the lymph system is very, very important. We don't often think about it.
You have 4 questions. They're all unrelated to what you're exactly talking about. They're all.
Do you want to do them now? We have 4 unrelated questions. Okay, go. I'm excited.
But related to inflammation.
Related inflammation, but not lymph. Okay, go.
When do you want them?
I want them now.
We'll do 2.
2, okay.
2 easy now. Can lack of estrogen, menopause cause connective tissue issues?
Can lack of estrogen in menopause cause connective tissue issues? Well, yeah, I mean, yes, the short answer is hormones affect everything in the body. There are estrogen receptors throughout the body, and collagen formation, protein creation is kind of dependent on things like estrogen and testosterone and really the balance of the two. So yes, estrogen does affect connective tissues. It can actually, like, some people think it affects the flexibility of connective tissue. And so like your flexibility will fluctuate through the month while you're still menstruating. So it is very important in the overall ability of the collagen to work together. And then of course, Pain is associated with estrogen. So with a lack of estrogen, and estrogen is also heart protective. So estrogen plays a very large role in the human body. Probably I should just do a talk on that one day because we do get a lot of estrogen talks, estrogen questions. But the short answer is yes. What's the next question?
I'm trying to get more information on this one because I think you'll need it, but maybe this will prompt them to tell you. We have Mr. John, who takes 3 omega-3 from us and a tart cherry. Is this the best formula for a 55-year-old active male? And so I was like, well, what's your health goals? What other information can you provide?
Okay. I'm assuming a middle-aged man taking 3 omega-3s in our tart cherry extract from the Well Theory, and he wants to know if that is enough or good enough or the best, I guess, stack for him. Personally, I take everything pretty much that we have every day, with some rotations of certain ones. For instance, the liver one I only take once a quarter. But omega-3, I think everyone should be on every day, yes. D3, I think everyone should be on every day, yes. I think as we age, NMN and resveratrol are extremely important. And then the tart cherry extract, I think generally, if you have any sort of pain or you're worried about any sort of inflammation or you're worried about brain health long-term, yes. Because it's the anthocyanins in the tart cherry extract are extremely powerful antioxidants, which can mitigate some of the problems of chronic low-grade inflammation. And also, they reduce the activity of the COX-1 and 2 enzymes, which we're going to get into later in this talk. And that's how they can reduce pain. But yet it doesn't have nearly, if any, of the side effects that non-steroidal anti-inflammatories do. So you can get all of the benefits of protecting your system from chronic low-grade inflammation without all the side effects of synthetic pharmaceuticals, I think. So yeah, you're at a good start with the omega-3 and the tart cherry. I would make sure you would take the connective tissue multi as well, because that has your D3, your zinc, your calcium, your vitamin C, and then PEA, all of which help connective tissue and help you feel better too. And most importantly, help the immune system. So back to the lymph system. So lymph fluid is integral to the immune system. We already talked about that. The primary cell of the lymph system is, not surprisingly, the lymphocyte. And the lymph is effectively filtering you all of the time. There are lymph ducts on the right and the left side. The thoracic lymph duct on the left side is the largest one. So the lymph system is very regulated. It's throughout the body. It's extremely important, and it's helping your immune system filter out all of the stuff your immune system says needs to get out. So this is what happens if you have too much tissue too long hanging out in your interstitial area. So that's the area between cells. So if that 3 liters a day doesn't get back to your heart and your venous system to be urinated out after it's filtered and managed, or breathed out as humidity or sweated out, and it just collects in your tissue, you get all of this swelling over time. Everything will become hard and fibrotic because fiber tissues are going to form in the interstitial membranes because of too much inflammation. All of the pathogen and the damaged stuff doesn't really have anywhere to go, so it's just hanging out in the fluid between your cells. And eventually you start to get skin infections, you get cellulitis, your skin can't manage its own sweat, so you get like dry, flaky skin sometimes, thick, hard skin sometimes, you get fungal infections. So lymphedema is no joke and needs to be managed if you have it. Next slide, please. All right, tonsils, another organ of the immune system. Tonsils are important to prevent pathogens from entering via the mouth or the nose. The mucous membranes, we already talked about it. They're in the respiratory system, protecting you from the air you breathe. Then the digestive system, protecting us from pathogens in the food we eat. And they're in the genitourinary tract, protecting us from anything entering any other mucous membrane location. The skin, extremely important, not just as a physical barrier, but there are also immune cells that are there circulating to recognize and destroy badness on contact. Okay. All right, so just to summarize everything that you've learned, so we're going to move on probably to like a little bit more about why you don't feel good when you have chronic low-grade inflammation. The innate system, we've got circulating white blood cells, we've got barriers or physical barriers, we've got the complement system. Adaptive, you've got B cells, they're going to use antibodies to attack pathogens. You've got T cells that are going to attack infected cells. And you've got all the organs that are important, the thymus, the spleen, the connective tissues, the lymph system, etc. All of this matters. They all work together, and they all should work in a coordinated fashion. And they're really only supposed to work when encountering a pathogen or injury. Okay, so the cytokines, the chemokines, this is really why you feel bad when you have inflammation, why you get swollen, why there's pain. These are very small proteins. They're signaling molecules. They're produced by many of the white blood cells. And as we said, even some of the complements create cytokines. There's macrophages, lymphocytes, and endothelial cells that are going to produce cytokines. And then certain cytokines are going to signal to the T cells to proliferate or to become more. So they're going to tell T cells, make more of you because we need you to go to attack this infected cell type that we just sent. IL-2, interleukin-2 seems to be important for that. And then there's regulation or regulatory cytokines. So IL-6, interleukin-6, interleukin-10. These are important in balancing and maintaining the homeostasis of the immune system. So controlling how many cytokines are produced, how many prostaglandins, how much inflammation there is, and then bringing it back when we don't need it. Problem with chronic low-grade inflammation is that doesn't happen. It's always happening. Like nothing is regulating it and telling the inflammation system to shut off and stop. So you're constantly inflamed. And then chemokines are like little chemical messengers they're like guides. They're going to guide the immune system cells, the white blood cells, to the site of injury or infection. And then there's different cytokines or cells that control the differentiation, or when the stem cells convert into different types of white blood cells. So every now and then it's bad enough that your stem cells are triggered to turn on and make new cells. Prostaglandins, which are very important to this whole process, these are lipid or fat molecules, okay? They have hormone-like actions though. They are actually formed at the site of tissue damage or infection. These will modify or modulate your inflammation. They regulate the immune function. They're supposed to be short-lived, and they actually influence pain dramatically. So prostaglandins will irritate nerve endings and actually trigger pain. So this is probably why when you're infected, or when you, like, let's say you have an injury, let's say you broke a bone, prostaglandins are formed at the site of injury to help clean up the debris and allow the repair process to begin. But meanwhile, they're irritating nerve endings and causing pain. So it hurts. And it's another way to signal. It's just another signaling system. Prostaglandins are formed from arachidonic acid. If you've watched any of our other talks, we've talked about arachidonic acid. Arachidonic acid comes from the phospholipids in the cell membranes, okay? And you have more arachidonic acid if you are filled with omega-6s. This is why seed oils aren't so great. All your cells are filled with omega-6s that preferentially go down the arachidonic acid pathway whenever triggered by anything in the immune system. So you form prostaglandins from arachidonic acid, and these hormone-like lipid molecules then begin to do their thing. They coordinate different functions, and they're all made on site, and they're meant to be short-lived and just stay in that one little area. Arachidonic acid, or AA, again, is formed from the cell membrane. Phospholipase is the enzyme that converts the phospholipid to arachidonic acid. The mediator, or the enzyme in between, is prostaglandin H2. And then you've got the cyclooxygenases, which is why NSAIDs work. This was going somewhere, I promise. COX-1 and COX-2, cyclooxygenase 1, cyclooxygenase 2, will convert the arachidonic acid into different metabolites, either eicosanoids or leukotrienes, both of which are extremely painful and inflammatory. So this is the process by which your body makes inflammation, or what we think of as inflammation, the redness, the heat, the pain, the swelling, is because the prostaglandins and their activity on the tissue, they're formed from cell membranes. The cell membranes are triggered to form them when they're signaled by the immune system. So COX-1, COX-2, again, formed from, well, it forms from arachidonic acid, meaning that the enzymes COX-1 and COX-2 are going to form the prostaglandins from arachidonic acid. They're actually the enzyme that do this conversion. They can form prostaglandin D2, prostaglandin E2, very important. Thromboxane, important in blood clotting and things like that. So it depends what prostaglandin you create, depends on what functional group from organic chemistry is attached to the ring of the arachidonic acid, and then the number of the double bonds there. COX-1 enzymes are found throughout the body. COX-2 is particularly induced by inflammation. And then we'll talk about some drugs later, but ibuprofen will downregulate COX-1 and 2. Celebrex and Mobric are supposed to only downregulate COX-2, and that has to do with the prostaglandins function on gastric acid secretions and other different things in the body. But remember, non-steroidal anti-inflammatories also affect how your heart works, because the prostaglandins are extremely important for heart function. So this is why a lot of people that have had ischemic heart disease or suffered a heart attack are told they can't take anti-inflammatories anymore, because the COX-1 and COX-2 enzymes are important for cardiac function. So the picture on the right is just showing you membrane phospholipids, so the fats that are in the cell membrane converted by a phospholipase to arachidonic acid. Arachidonic acid is converted by either a cyclooxygenase or a lipooxygenase into either prostaglandins or leukotrienes. And those are the functional molecules that actually trigger the actions of the, what we consider inflammation. So what do prostaglandins do? They can either turn on or inhibit platelet buildup, depending on which one is triggered when. So they can cause blood clots or diminish blood clots. They can vasodilate or vasoconstrict. They can bronchodilate or bronchoconstrict. A lot of asthma medications play off of this and will cause bronchodilation to help people breathe easier. They influence pain perception. We sort of already touched on that. They induce uterine contractions, okay? Prostaglandins are very functional in terms of menstruation. A lot of menstrual cramps are because of a preponderance of prostaglandins that are formed. They decrease eye pressure. They inhibit acid secretion. They contract or relax smooth muscle, and then they regulate hormones. So prostaglandins have a ton of functions and features in the human body, and that needs to be remembered whenever we're trying to mess with the immune system. So PGE2 is your most abundant prostaglandin, formed by prostaglandin E synthase, and it signals through a certain type of a receptor, okay, and it's degraded by a certain type of enzyme. Remember, they're short-lived. So they're formed, an enzyme will come in and get rid of them if everything's working well. This little picture has a cartoon. You probably can't read it, so I'm going to read it to you. Me, quote, immune system, why do I have a fever, end quote. The immune system says, quote, because the infection can't survive very long above 98.6 degrees Fahrenheit, so I rose the temperature to kill it, end quote. And then me says, quote, I also can't survive very long above 98.6 degree Fahrenheit immune system, end quote. I put this in here because when you have a fever, it's for a reason. It's to kill the bacteria. But again, prolonged fever will actually also kill normal cells over time. There's very few things that are super tightly controlled in the human body. One of them is temperature, okay? So when your body decides to elevate the temperature, it's doing it for a particular reason. And of course, what do? We try to stop that immediately. We take medicine. We're like, oh, you can't have a fever. Must stop it. But remember, your body's doing it for a reason. Next slide. So why do you get a fever? So you get infected. There's then a pathogen-associated molecular pattern that emerges, a PAMP, P-A-M-P. The PAMPs bind the PRRs. What is a PRR? A pathogen recognition receptor. So the cells of the immune system are going to have a receptor that recognizes certain molecules off of badness, the pathogen-associated molecular pattern. They'll recognize it. It gets triggered, and you're going to turn on macrophages, neutrophils, dendritic cells, all the white blood cells of the immune system. Cytokines are released. You've got IL-1, TNF-alpha, IL-6 running around. Prostaglandins are then formed. And then what happens in the brain is certain cells in the brain bind the prostaglandins or the circulating cytokines, and then that triggers a change in the hypothalamus's thermoregulation, and you will increase your temperature, and it does it through a variety of ways. But basically, the fever is meant to raise the temperature above where the immune system feels the pathogen can live. So it's trying to kill the bacteria. So it actually matters. And then other things happen in your body that are also all designed to try to kill the bacteria. You lose your appetite, so it's trying to basically starve the bacteria. You go into this fasting state where all of your cells get repaired and recycled and tightened up. This is one of the reasons why intermittent fasting is so popular. And then, of course, you have muscle pain and things like that. But the primary reason we get feverish is because your body wants to elevate the temperature enough to kill the bad guys. And it does it in that little tiny spot where that red arrow is showing in that brain MRI. That is the thermoregulatory center where the thermoregulatory neurons are. It's the median preoptic nucleus of the hypothalamus. So temperature is adjusted upward with infection because cytokines get there that were triggered by pathogen-associated molecular patterns. And then the fever is maintained until the infection's resolved. This is IL-6 dependent. Well, if your immune system is dysregulated or messed up, this is not as fine-tuned as it should be, and you may get fevers when you shouldn't. You may get a fever that's prolonged, or you may not have a fever that lasts long enough. This is why people with metabolic disorders or metabolic syndrome tend to get sicker, and the sickness lasts longer, and they have sickness more frequently. This whole system is just dysregulated because nothing's really coordinated well, because the cytokines aren't working in a coordinated fashion because they're constantly being produced by the adipose. So just remember, fever is for a reason. Yes, it's uncomfortable and unpleasant and you sweat and all of that, but the body does it for a reason. Prostaglandins, again, are lipids or lipid molecules, and they're going to produce eicosanoids. Those are 20 carbon fatty acids. It is a ring structure, and there's certain positions that have oxygen molecules attached. And how each prostaglandin functions at a cellular level depends on where the oxygen is attached to the molecule and how many are. And that's it. That's the only difference. And then there's two hydrophobic, meaning they repel water, hydrocarbon chains that extend from the central ring structure. They vary in length and the degree of unsaturation. What is unsaturation? Double bonds of carbon. We talked about that when we talked about fat and lipids. And that can also change the function of prostaglandins. So very small differences. How many double bond carbons are there on this little lipid product? And where is the oxygen? Can dramatically change what they do. I gave you that list of functions of the prostaglandins. It's pretty amazing. The tiniest little things make a huge difference in the human body. So phospholipase A2, we talked about this. This is the enzyme, remember, that converts the phospholipids of your cell membrane into arachidonic acid. Guess how steroids work? They turn off phospholipase A2. So steroids give you such a massive anti-inflammatory effect. And you know, when you feel sick and you go to the doctor, say, give me a shot of steroid, and they give you a shot in your butt, they're turning off phospholipase A2 indiscriminately throughout the body. So you basically are never forming the arachidonic acid anywhere. So no inflammation is being formed. Meanwhile, you're producing more cortisol and things like that. So you feel really good short term, but you've completely dysregulated this whole system. So phospholipase A2 is the first and most important enzyme. That's what's turned off by corticosteroids. Then you have your COX-1 and 2 and your lipoxygenases. These are turned on and off by your non-steroidal, get it? Because they're not touching phospholipase A2. COX-1 and 2, they're going to turn off those enzymes. So you're not going to get those particular prostaglandins formed. And then the prostaglandins bind receptors on a cell surface and trigger a cascade of events. Anytime you bind on a cell surface, what happens is a receptor usually goes into the cell, or it sends a signal into the cell that eventually gets to the nucleus, and a gene is either turned on and off. So the prostaglandin will bind the cell, send a signal, and then usually what happens is the cell will upregulate all of the pro-inflammatory genes and bring in more white blood cells, bring in more macrophages to clean up the debris, so on and so forth, until, in theory, there are fewer of those damage-associated and pathogen-associated molecular patterns as things get cleaned up and made better. And you should turn that system off and then turn on the clean repair system. What happens with a dysregulated immune system where you're constantly inflamed because you're constantly have too much glucose, too many reactive oxygen species in your mitochondria. You've got mental stress. You've got poisons and toxins from pollution, et cetera. You're always having these things turned on, and there's never quite enough of a drop in the damage-associated molecular pattern to turn off inflammation. Excessive prostaglandins cause chronic pain, increased pain sensitivity. So that's called hyperalgesia or allodynia. That's when, like, if you just rub your skin and it hurts, well, that's not normal. That is increased pain sensitivity. Painful menstruation, heavy bleeding, all from prostaglandins. Cramping, muscle cramping, uterine cramping, gut cramping, all from prostaglandins. And then certain types of cancers we think are triggered by prostaglandins. So these are not benign little lipid molecules. We already talked about the medications that can turn them off. Aspirin, ibuprofen, naproxen, the list is long. And then the COX-2 specific, or mostly specific to COX-2 inhibitors, are going to be like your Celebrex and your Mobic. And if you all remember, if anybody out there is old enough, there was Vioxx too. Vioxx was awesome for pain control, but it was then linked through a series of lawsuits to also promoting or propagating heart disease and heart attacks. So Vioxx was actually removed from the market, but in that same family of molecules, we still have Celebrex and Mobic. But that's what I'm talking about. You know now why these anti-inflammatories can potentially have all of these side effects, because they are massively turning off certain prostaglandins kind of systemically when you take them. So the risks of taking non-steroidal anti-inflammatories, which is one of the reasons I love natural medicine, because natural products don't seem to have any of these, or if they do, they're so tiny, it's almost irrelevant. You would have to massively dose. NSAIDs can elevate your blood pressure. They can cause renal impairment or damage your kidneys. They cause gastritis. One of the primary or number one reasons older people go to emergency rooms in this country is for gastric bleeding brought on by NSAIDs. Heart disease, we just talked about, and they're prothrombotic in some cases. They can actually, you think of them as thinning the blood, but in some cases, especially with COX-2 inhibitors, they can sometimes thicken the blood. So non-steroidal anti-inflammatories are not benign. I try to get any and all of my patients onto a regimen of natural anti-inflammatories so that when and if they do need these drugs, they don't have to take them as often or at higher doses. Does that make sense? Like, you still may need ibuprofen, but it's not like you're going to need it every single day, three times a day. If you're on a naturally anti-inflammatory diet, you take care of yourself and you take some natural anti-inflammatories. We're going to talk about those later, but things like turmeric, ginger, PEA, resveratrol, tartary extract, etc. All of that really matters to keep your system tuned and balanced so that you don't have to do this to yourself. What are the natural substances? So here are just some. So quercetin, which is in apple skins and onions, things like that, can block COX-1 and 2, but it doesn't block it in the same way that the synthetic pharmaceutical grade drugs do. Those things are like bringing in, the mother of all bombs when you could just have like a tiny bullet, right? So synthetic drugs are designed to turn off a single enzyme at a massive level. The natural things are way more gentle and have also what's called the entourage effect. So usually natural things come with multiple molecules that are doing many beneficial things at once to achieve the same effect of a synthetic chemical that usually just turns off a single enzyme. So quercetin, apple skins and onions, COX-1 and COX-2, curcumin, which is in curry, or turmeric. COX-1 turns off. Boswellia, which is frankincense, seems to turn off leukotrienes a bit. Green tea will help to downregulate your tumor necrosis factor alpha and COX-2. Gingerol, COX-1 and 2, capsaicin, COX-1 and 2. Capsaicin also diminishes the response of your TRPV receptors, which are the pain receptors that give you the sense of heat and burning. Beta carotene, COX-1, berberine downregulates COX-2 and also helps you manage your glycemic index. So berberine is natural metformin, but it also has an anti-inflammatory effect. Turns out, though, there are studies that show that if you take metformin and Celebrex, you delay the need for total knee replacement by about 5 to 6 years. So I've done that for some people, but the best way to do it is naturally. So berberine, joint health multi, green tea, things like that. And then Voodoo Lily, which this is a picture of that, which is a Japanese product, COX-1 and 2. So the reason I promote natural medicine is not because I just think it's cute. There is a ton of science behind this. This is not an exhaustive list of the only natural substances that turn down prostaglandins. There are many, many more. We probably don't have time to get into all of them. We've already talked about tart cherry, which has anthocyanins that also turn down COX-1 and COX-2. So lipooxygenase is another enzyme. Here's your membrane. That's the water balloon of the cell, okay? All the organelles and the nucleus are inside. You've got the water balloon, and then you've got outside the cell. Phospholipase A2 pulls out little pieces of phospholipid, turns it into arachidonic acid, and then you've got various enzymes that then turn those either into prostaglandins, thromboxanes, leukotrienes. Lipooxygenase is just one of those enzymes. Will metabolize arachidonic acid into leukotrienes, which are very painful and irritating. So what are the targets of the immune system? We've kind of gone over this, but I just want to refresh your memory because we just got deep in the weeds with cytokines and prostaglandins. The targets are viruses, bacteria, parasites, prions, things like that. Anytime you get injured, somebody's got to go in and clean up the dead, damaged cells and then help rebuild things, okay? Who does that? The immune system. Senescent cells, these are cells that have just they've reached their replication limit, like they can't divide and renew themselves anymore. They become senescent. So they can either become a zombie cell and start producing damage-associated molecular patterns all the time, which is what happens if you're metabolically dysfunctional, or your body can come in, clean them up, recycle all the parts that are useful, and put them into good cells. And then you've got your adaptive system. This is your remember and recognize system. Faster response to pathogens because of the B cell memory with antibodies. And then this is less involved in injury, more involved in infection. All right. So again, the target, damaged cells and tissues or pathogens. The time course of acute inflammation is going to be a little bit shorter. With infection, it might be a little bit longer than with injury, but not really. But think about this. Whenever you sprained an ankle or sprained anything, you had that sort of really bad phase in the beginning. It was like the first week, and then things will get better, right? The peak of swelling is usually day 3, and it all has to do with the stepwise progression of the inflammatory system. You know, the innate system coming in, cleaning up debris, then the adaptive system coming in, then the macrophages coming in, and then proteins being built and repaired. All of that happens on a time frame. This is why we can pretty much tell people after surgery, this is when you're going to heal. This is when you're going to feel this. This is when you're allowed to start walking. It's because we know the immune system's going to heal things after surgery in a certain way, in a certain pattern, and in a certain time frame. Infection gets a little bit more squirrely depending on the quality of your immune system. Adaptive immune system, not so involved in injury, very, very involved in recognizing and remembering pathogens. And then the mediators of injury is damage-associated molecular patterns. In infection, it's pathogen-associated molecular patterns, and they're different, and the body can recognize them as such. And then in injury, you're going to eventually end up with tissue repair and regeneration. And in infection, the whole point is really just to get rid of the viruses and the bacteria. But all of these work together. Chronic low-grade inflammation, okay? Risk factor number 1 for non-communicable diseases. 50% of deaths worldwide now are because of non-communicable diseases. Cancer, cardiovascular disease, diabetes, respiratory. This is what we now call the invisible epidemic. It is hugely important and it is preventable, which is the really sad part. Chronic inflammation causes direct tissue damage. We've already talked about how this began to be discovered in the 90s with the inflammation of plaques and the oxidized LDL in plaques and how that was linked to heart disease, strokes, and things like that, and hypertension. Cell dysfunction is the beginning of this with mitochondrial failure. Somebody in the beginning of the talk asked a great question about that. When the mitochondria fail because of sugar overload and fructose overload, and you get insulin resistance, the cells do not function properly and your immune system can't function properly. And then you have more damage-associated molecular patterns, which trigger further immune. Oxidative stress from too many reactive oxygen species produced by the mitochondria, and also from altered fat metabolism because of excess energy. Again, creating more damaged cells, more adipokines, leading to more inflammation, more reactive oxygen species. These are rusty nails. I put that there to remind you of what's happening to your body with oxidative stress. That is oxidative stress on metal. You're doing that in your body all the time if you have too many reactive oxygen species running around. And what causes that in us? Tobacco, too much toxic alcohol, so excessive alcohol, unhealthy diet, fast food, ultra-processed foods, pretty much the American diet, physical inactivity, very important in terms of causing chronic inflammation, messed up metabolism and oxidative stress. And then air pollution, I'd probably add to that water and soil pollution. And then what's also not here is mental stress. The mental stress we are under all the time that upregulates our cortisol, upregulates our immune system and inflammation and gives us chronic low-grade inflammation. This is why the number one or the best way to treat heart disease is transcendental meditation over anything else. If people can control their mental stress, they have fewer heart attacks. So the chronic production of prostaglandins, this is the problem, stimulated by tissue damage, infection, and the inflammatory signals, the complement system coming in. The continuous activation of those enzymes, the lipooxygenases and the cyclooxygenases. Arthritis induces cyclooxygenase activity inside of the membrane around each of your joints. And this causes sustained prostaglandin production. Anybody out there with an autoimmune disorder, that is what's going on. You're having sustained prostaglandin and cytokine production inside of your joints all the time because of upregulation of either IL-6 or TNF-alpha or whatever. And then prostaglandin E2 will amplify its own production until it's turned off, but nothing's turning this off in some cases. And so you want to have your specialized pro-resolving mediators involved. This is what helps you turn off inflammation. How do you get that? You get that if you have enough omega-3s in your system. So if the omega-3s are pulled out of the cell membrane and converted by phospholipase A2, they will actually eventually turn into little molecules called resolvins or protectins. And they actually are designed to be anti-inflammatory, to turn off this very hard-hitting, heavy inflammatory system and begin the resolution and regeneration phase. This is why I try to get everybody on omega-3s, especially those with pain, because your omega-3s really, really help reduce inflammation in your body and help your body heal itself and turn off this chronic inflammation. So again, I live in a state and I'm surrounded by chemical plants like this. Every grocery store, about 80% of what's in a grocery store is ultra processed, meaning it's effectively fake factory created food stuff. Mental stress, we talked about that, very, very common in modern life. Environmental toxins, you're breathing them, they're in your water, they're in the soil that's growing the food. And then that's before we even talk about pesticides and fertilizers. We have way too high of an omega-6 to omega-3 ratio in our bodies because everything we eat is so corn and soy oil heavy. That is what's in every ultra-processed food that you eat and all of the animal proteins that you're eating, unless you really look hard to find stuff that doesn't have that. And then probably one of the biggest determinants of this is terrible sleep. So the only time your body can resolve, repair, regenerate, and help the immune system out is through sleep, fasted sleep ideally. So all of this is combining or conspiring against you to keep those damage-associated molecular patterns from ever going away, and why we have chronic low-grade inflammation. We have a question.
Is the inflammation caused by shockwave therapy beneficial?
Is the inflammation caused by shockwave therapy beneficial? Theoretically, shockwave therapy is going to use sound waves to mechanically irritate cell membranes and cause damage-associated molecular patterns. It should just be acute inflammation in that case, which would be the immune system that's triggered to repair injury. So yes, if you have a normal immune system and you're not metabolically dysregulated, in theory, that should induce acute inflammation to promote healing, kind of like dry needling does. About a Baker's cyst? Sure.
Bernadetta.
From whom?
Bernadetta.
Okay, Bernadetta has a question.
She has RAH. she was told she needed a knee replacement, and now she has a Baker cyst behind her left knee. What can she do because it's giving her pain?
Okay, this is a female diagnosed with rheumatoid arthritis who was told she needs a total knee. So I presume she's got enough changes on her x-ray that shows physical change to the knee joint from the rheumatoid arthritis. And now she has a Baker cyst. All a Baker cyst is behind the knee, there is a little potential sac that will fill with fluid if you have irritation inside of the knee joint. So in the knee joint, if the synovial lining, which is being triggered by the TNF alpha, is producing prostaglandins all the time, and there's inflammation and excessive fluid inside of the knee joint, it has to go somewhere. So it usually goes into this little potential space behind the knee, which we call a Baker cyst. There's different ways to manage it. First of all, you got to reduce the inflammation, the underlying cause. So if you're not on a drug for rheumatoid arthritis, that would be where I would start. Omega-3 has been studied in rheumatoid arthritis in many studies and been highly successful in reducing that inflammation. Turmeric helps to reduce that inflammation. The tar cherry extract can. Offloading with certain braces, like if you're compressing on the inside of the knee joint versus the outside, you can change that with bracing. Weight loss always helps. Physical activity and getting strong, getting the quadriceps strong and the calf muscle strong and the hips, believe it or not, really helps. And then sometimes you can just drain that Baker cyst. So we can actually put a needle in and drain it off, and then sometimes inject steroid behind it. Why? Because the steroid's going to turn off the phospholipase A2 and give a quick reduction in inflammation inside of the knee joint. Now, long-term steroids are terrible for cartilage and soft tissue and connective tissue. I am no fan of steroids, but for somebody in a significant amount of stress with a known inflammatory arthritis, sometimes it's necessary just for that symptom management. So that's where I would start, but I would make sure the rheumatoid arthritis is treated first of all.
Keep going.
Let's go. So ultra-processed foods are a major source of chronic low-grade inflammation, leading to non-communicable diseases in this country. There are hydrogenated and saturated trans fats that dysregulate the lipid system and create excessive reactive oxygen species and inflammatory mediators. Seed oils are replete with omega-6, and they're usually processed in a factory with a bunch of chemicals. Emulsifiers can induce inflammation. A lot of these aren't even mentioned in the ingredient list. Coloring agents, we've all heard that red 3 was just banned for causing cancer. I'm not sure yellow 5 and blue 5 and red 40 are off the hook yet. Remains to be seen. Excessive amounts of sodium. And the reason that matters is if you have excessive sodium, it kind of balances the excessive glucose in the food. And if you have just the right balance of sodium and glucose, people will continually eat more of it. And they'll never stop because neither system is triggered enough to turn the brain off and say, I don't want any more of this. The addition of glucose and fructose, as we said, in everything, and God forbid high fructose corn syrup, we're not going to go there. High heat processing of ultra-processed foods increases the amount of what are called advanced glycation end products in the food. These are abnormal dysfunctional proteins where an amino acid combines with a glucose, and those trigger inflammation and those trigger oxidative stress. Whenever you make ultra-processed foods, all of the fiber is typically extracted from the food so that it is easily digestible, quickly digestible, and gives your brain the quick dopamine hit it needs from that sugar rush. If you have too much fiber in food, that doesn't happen. So what do? They pull the fiber out. And then, of course, chemical processing. All of this happens in almost all of the ultra-processed foods we eat. So imagine the inflammation and oxidative stress that is causing with every bite. We already talked about the high omega-6 content, the seed oils. Linoleic acid is converted directly to arachidonic acid, which goes down that pro-inflammatory, high levels of prostaglandins, painful, inflamed world. You want to go the other way, the omega-3 way, if you can. And then high glucose levels induce insulin resistance. And if your cells are insulin resistant, nothing works right. So you cannot be insulin resistant and expect to have a working system. And by the way, just because your A1C is still in range does not mean you're insulin resistant. If you're curious, ask your doctor to order a fasting insulin level and see where you really are. And then, of course, the disruption of the gut biome. A lot of our health and our control of inflammation is actually controlled by the bacteria that live within us. There are more bacterial cells in your gut than there are cells in the human body. So they actually matter to a degree more than our own human cells. If you don't treat them properly, nothing works well. So this is showing you the advanced glycation end products that are formed with high heat processings of foods. The top left piece of red is your lowest acrylamide levels, and the bottom right, the burnt piece of toast, is your highest acrylamide levels. Acrylamide is formed during high heat processing. We see this in a lot of processed meats, actually. But this is just showing you with bread. As more and more of these advanced glycation end products are formed, you get this darker and darker crusting. Okay, the same thing when you sear a steak. Okay, whenever you get that savory smell and that crispy skin, and it gets a little bit firmer and crunchier, and it changes its character and becomes more flavorful, that is advanced glycation end products. And they do smell good and they do taste good, but they're not necessarily good for you. BPA, which is bisphenol A, has been shown to increase levels of IL-6 and CRP. A lot of plastics today now say BPA free because people have recognized this. The industry didn't, the people did. Problem is, we don't know what's replaced BPA yet and what it's doing to us. Acrylamide, we talked about. Acrolein, also formed in high heat, and this is why processed meats aren't very good for you. Phthalates, which are found in the packaging and in even receipts and things like that. And the glycosylation, which we talked about, the abnormal proteins. When you get your hemoglobin A1C checked, what they're looking for is the amount of glycosylation on your red blood cells. So the more glycosylation, that means the more sugar's been floating around in your blood for the past 3 months. It's just an indirect marker of advanced glycation end products. And then these, when you get glycosylated cells, things get damaged. And what do? They send out damaged associated molecular patterns, which does what? Triggers the innate system and then eventually the adaptive system, and you get a chronically low-grade inflamed state. So this is just a chart showing the amount of acrylamide in different foods. This was in Germany, actually. The highest levels were seen in vegetable crisps, which I think that's their word for fries. So the most acrylamide was found in French fries, basically, just so you know. So if you're going to eat French fries, don't eat them every day, and don't eat a lot of them when you do eat them. Next slide, please. Yeah, it is hard to see. These things are in everything, but your body has the capacity to process them at a certain level. You just can't be eating fast food 3 meals a day, every day, like a lot of people do, believe it or not. Ultra-processed foods and inflammation. So again, unhealthy fats, saturated and trans fats, all linked to inflammation. Sugars, rapid spikes in blood glucose, insulin resistance, too much overload on the mitochondria, promotion of inflammation and oxidative stress. Refined carbohydrates are basically the same as eating a teaspoon of sugar. Low fiber, so your gut biome is damaged and messed up. Everything gets digested too quickly and too fast. You get too much of a brain hit of happiness, and then your system gets overloaded with a glucose spice. And no anti-inflammatory short-chain fatty acids are produced in your gut because your gut produces them when it digests fiber. So this is all conspiring against you, but they do taste delicious. That's why ultra-processed foods are so popular and everybody still buys them, and why PepsiCo's earnings were really good last quarter. And then low micronutrient intake. Most of these have all of the micronutrients or vitamins and minerals pulled out of them. And then notice how breakfast cereal all says fortified with. Then they add it back in so they can make it seem healthy to you. So fortified with essential vitamins and minerals. Well, that started because they pulled so much stuff out before that people were getting pellagra, which is a disease of B deficiency. And they were like, it was not a pretty scene until they maybe it was folate. So they started adding it back in. And now we have fortified with essential vitamins and neutrals in our ultra processed foods. So this whole system that we live in is not so great. You just need to be aware of it. Know your body system can handle some of this, but it cannot manage this if this is your world all day, every day. You're welcome, Kylie. She said, thank you for the information. I think it's important that everybody knows this, or at least starts to think about it. So we talked about omega-6 and omega-3. The Japanese are healthier than us because they have a higher omega-3 ratio than we do, meaning there's more omega-3 in the cell membrane phospholipids than we have. So when the system is signaled to pull the phospholipids out and convert them by phospholipase A2 into an inflammatory cascade, the omega-3s will go down the more of the anti-inflammatory, let's kill the pathogen, but then let's quickly regenerate and rebuild. If you have too many omega-6s in your system because you are eating seed oils all the time and animal proteins made in America that aren't grass-fed and grass-finished, then you're naturally always going to be in a pro-inflammatory state. So you have to supplement with omega-3, I think. I don't really say eat seafood anymore because the seafood industry is so corrupt and suspect, and there's a lot of badness involved in that industry, and a lot of the fish are farm raised and they're fed corn and soy, so they don't even have omega-3 in their tissues anyway. So we get omega-3 sourced from Scandinavia waters. They're all tested by a third party for pesticides and things like that. So I supplement because I want a lot of omega-3 in my cell membranes. I don't want a lot of omega-6. I also try to avoid seed oils and really only use olive oil if possible, maybe avocado oil. All of this is important. Some people, particularly friends of mine who are other orthopedic surgeons, they think I'm crazy and that this is voodoo, but there's just so much science behind this now. It's irrefutable, my opinion. So you want a lot of omega-3 in your system, so you need to supplement if you live in America. So we have omega-3 in 2 ways. We have a single molecule omega-3, which I take, and then there's the nervous system multi, which I'll alternate the two. The nervous system multi already comes with omega-3 in it, so you get 2 capsules of omega-3 and then 2 capsules of all of the other ingredients in the nervous system multi, which includes N-acetylcysteine, which goes to glutathione, resveratrol, things like that. Some products from green algae that chelate heavy metals. The nervous system multi is a great supplement to take, particularly if you're worried about neuropathy, brain health, the way the myelin sheath of your nerve cell functions, the way your brain cells communicate to each other. The other thing is I tried to make the DHA to EPA ratio a little bit more than you'll find elsewhere because DHA is so important for the cell membranes in the brain. So you can get it either through the omega-3 single molecule or the nervous system multi.
Deb, she says, I love your live seminars. Good information. Thank you.
Deb said that she loves the live seminars and gets good information from them. So thank you for watching it. That's why I do it, to try to help everybody understand the basics of human physiology so you can better take care of yourself.
Pamela, she's like, I love your products. Been using the Well Figure for 2 years. They do work. Thank you.
Oh, that's nice. Pamela said, thank you. And she's been using our products for 2 years and that they really do work. And I really appreciate that. That's the kind of impact I want to have. And that makes me happy. Thank you. All right. I think we already talked about this in detail. Mental stress we talked about. I just want to briefly go over it again. So when you have mental stress, there is a very complicated interplay between your hormones, the immune system, and your neural system. There's a dysregulation of the hypothalamic pituitary axis, okay? Overaction, you get excessive cortisol production. Cortisol will initially suppress inflammation. We talked about that, right? That's why we give corticosteroid shots in medicine a lot. But persistent levels of cortisol dysregulate the system, and it changes what's normally known as a negative feedback loop. So you constantly have this cortisol, and your system then doesn't know when it's supposed to produce it in a normal fashion. And you're having constant cortisol production because you're constantly mentally stressed. You're triggering your sympathetic nervous system. You're turning off the parasympathetic, and you're making all of this cortisol all the time. And then you get glucocorticoid receptor resistance, almost like insulin resistance. And then your immune cells are constantly releasing pro-inflammatory cytokines. So mental stress is a real thing. There's a real brain-body connection, typically through the vagus nerve and a few other things like we talked about. The hypothalamus is one of the links. The gut biome, which creates neurotransmitters and links to the brain. So if you're constantly stressed out about finances or family problems or the world around you, or you watch the news too much or whatever, you're going to be constantly upregulating the cortisol and inducing inflammation over time. It's not like the cortisol when you go get a shot in the butt to feel better for a day or two. But think about if you got that shot in the butt every week, all week for a year, you would be in a world of hurt. And everybody knows that. That's why no doctors let you do that. Or they shouldn't. Now, some pain doctors I've seen give people pain injections that often, which I think is probably a problem. Mental stress, again, increased pro-inflammatory cytokine production. Your interleukin-1 beta, interleukin-6, your TNF-alpha. And these are also, believe it or not, associated with depression and anxiety. Now we know mental stress and too much inflammation in your body can actually cause mood disorders. And that's being looked at in the pharmaceutical world to try to mitigate that and make new antidepressant drugs, because the ones we have don't seem to work that great. Damage-associated molecular patterns, because of stress, because of the excessive cortisol, induce cells to release the molecular patterns. Those bind the pattern recognition receptors on the white blood cells, and you get more inflammation. So again, it becomes a self-feeding cycle, all caused by just upregulating cortisol and other neurotransmitters from the constant mental stress. We already talked about why we give steroids. And then steroids actually, believe it or not, it was created in 1960, dexamethasone, to treat rheumatoid. But a neurosurgery resident started to use it in brain surgery. I'm not sure why he started doing that. I didn't find that paper. But it's been used to reduce cerebral edema or swelling in brain surgery and with spinal cord damage and stuff for about 60 years now. Some newer immunotherapy science is finding that this blanket way to reduce swelling and inflammation is probably not the best, because why? It's highly immunosuppressive. So the immune system is altered so much with the application of these kind of drugs that everything gets dysregulated and you can't really predict healing. But it's still used to this day to reduce swelling around the brain and spinal cord. But it was invented in the 1960s. It's been around that long. I have some dexamethasone in my clinic, actually. We talked about, I just want you to remember, you've got the innate system, the adaptive system. It's a whole cascade of triggering events, and they work together. Innate's your first line of defense, adaptive's your second line. They should be short-term, short-lived, and serve a function. But we've talked about all the reasons why we have chronic low-grade inflammation. And then that, in turn, damages proteins, damages DNA, damages cell membranes, damages mitochondria, and leads to non-communicable chronic disease. So the sickness behaviors are what you think of or what you feel when you're sick. They're there for a reason. We sort of talked about that too. You get a fever for a reason. Your body will also change your metabolism for a reason. It wants to sort of make it harder for the bacteria to survive. So you lose your appetite and you don't want to eat. Muscle aches and pains happen because of the connective tissue issues. The brain fog happens because of what's going on in the brain with all of those prostaglandins. And then you get fatigued as well. In fact, injections of TNF-alpha experimentally have been shown to cause system-wide fatigue. So it's probably why a lot of people with autoimmune disorders have chronic fatigue, because the body's typical way to manage infection is being hijacked and used against you with an autoimmune disorder. But all of these things, the brain fog, the irritability, the fever, the fatigue, the decreased appetite, they're all brought about by these cytokines, the TNF-alpha, IL-1 beta, IL-6, interferon gamma, that are brought about by the induction of the innate and adaptive immune systems. So I wrote a book about natural healing and how you can use it to avoid orthopedic surgery, hopefully, and really even hopefully avoid steroid injections. It's got different chapters that build on each other and give you sort of a protocol, meds I call it, which is mindset, exercise, diet, and sleep, to help harness the immune system in a good way and to control it and to empower you to be healthier and feel better. So we do have a book that I wrote. It took me like 3 years to get that project done, but it was a labor of love. It's a good guidebook, so hopefully it'll help you if you end up getting it. And it kind of goes into all of this in more detail. And then I just wanted to read one thing to you, a testimonial, because this is one thing I've noticed with people. They expect an instant, like, Norco or oxycodone type response when they take natural medicine, and that's not how natural things work. If you've been eating fried food your whole life and I said go on the Mediterranean diet, if you did that for one day, you would not feel better. You have to eat the Mediterranean diet for like a month or 2 or 3 months to really have systemic change and feel better. The same is true of natural medications. So this testimonial says, happy I'm trying it. What?
It's not testimonial. It's kind of like a point that you want.
Oh, sorry. It says, I have noticed a difference with my sleep. That was pretty immediate. I'm not sure how much it's helping pain. I work out and get some muscle soreness. I have some arthritis in my shoulders that I notice more at night, but I'm only about 3 weeks in. I'm glad I have it and plan on continuing to use it for all of its benefits. This is specific to the tart cherry extract. And I'm glad this person is going to stick with it because it's going to take, it usually takes in most of the literature, I want to say 45 to 90 days for natural substances to get enough in the system to downregulate those genes that turn on inflammation. So the anthocyanins in tart cherry extract will actually downregulate the NRF kappa beta gene that is pro-inflammatory. That's why it can be as powerful as the ibuprofens and stuff, but not cause all of the side effects because it's reducing your inflammation in different ways, in entourage effect. It's somewhat turning down COX-1 and 2, but also turning down NRF-KB, and then also providing antioxidant molecules to take out those free radical species that are produced with inflammation. Tart cherry extract is very, very good for pain. It's very good for gout. It's very good for muscle soreness. 3 weeks in, you'll probably start feeling a difference, I'm going to say in about 2 to 3 weeks. But the important thing is to stick with this. You may still have pain that requires synthetic chemicals, but you're going to notice that you take ibuprofen, naproxen, aspirin, whatever, far less often. Like you'll have the same bottle of ibuprofen in your house for a year if you're on this, which is better for you overall, I think. So when I have patients that come in with inflammation and they hurt and they're achy and their joints creak and they don't want to take ibuprofen or Celebrex for whatever reason, either they had gastric bypass surgery and they can't, they have one kidney and they can't, they have chronic kidney disease and they can't, they've got gastritis and they can't, they've had prior heart disease and they can't. There's a million reasons why people are unable to take non-steroidal anti-inflammatories, or more importantly, don't want to. So I put them usually on the Joint Health Multi in the morning and then stack it with the tart cherry extract at night. The Joint Health Multi has turmeric, very well known to reduce inflammation. So is ginger, which has gingerol. That's the active flavonoid. And then PEA is palmitoyl ethanolamide. That's part of your innate endocannabinoid system. And PEA will actually turn down mast cell, that's a white blood cell, release of inflammatory mediators on nerve endings. So it actually reduces pain. And then black pepper, which makes turmeric more active. Tart cherry extracts about 1,500 milligrams of the anthocyanins, which are hugely antioxidant. So for me, I take that for its antioxidant effects, but it's really good for pain. So Joint Health Multi in the morning, tart cherry at night. You may ask why. The reason is most of the pigmented fruits from which we derive the tart cherry extract naturally have melatonin in them as well. And the last thing you want to do is mess with your cortisol melatonin spikes and oscillations because you have to get good sleep. So I usually tell people and recommend that they take tart cherry at night. We stack things just to get the benefits of different substances on different cells that synergize and build on each other. So for a lot of people, the Joint Health Multi is just not quite enough. So the tart cherry extract at night gives them that added molecule to detoxify whatever tissues are left to be detoxified to help with the pain. So stacking is good because it gives you more of different types of antioxidants that will neutralize different forms of oxidative stress in your body. Same with inflammation.
To piggyback on this, we have a question.
Another question.
What 3 products you would recommend? So for chronic inflammation. So they weren't
the 3 products, I would say the connective tissue multi, either with CBD or PEA, because that's got vitamin D3 in it, which is mandatory. And then the Joint Health Multi, the tart cherry extract, and then I'm huge fan, obviously, of omega-3. So either through the nervous system multi or the single molecule omega-3. Probably should be on all four. I take them and more, but for a proper functioning immune system, you've got to have vitamin C, which is an antioxidant, zinc, which is a cofactor for a lot of different processes, magnesium, same thing, calcium, which is important for intracellular and neuronal or neuron communications, in addition to bone health. And then the turmeric, for the reasons we discussed, anti-inflammatory, both the turmeric and the gingerol, and the PEA reduces nerve pain. And then the tart cherry extract, which has a different antioxidant molecule, the anthocyanins, which are flavonoids, which we've talked about in the talk on oxidative stress. And then I just love D3. Most people are D deficient.
All right. Rena says, thank you so much for sharing your knowledge and making great products.
Thank you, Rena. She just said, thank you for sharing my knowledge. You're welcome. And for making great products. I appreciate that. It took us a long time to find a factory in the country, by the way, that we trusted. None of our APIs are from countries known to produce bad APIs, and we get everything third-party tested.
We have Robert. He's got a really long deal, and they can read it, but not just summarize. So Robert, he's like, I don't even know how to formulate a single question succinctly. I appreciate you calling out the ridiculous damage inflicted to us by our diet and environment. I'm struggling to try to navigate this. I already take a fair amount of meds and supplements, can't afford every supplement you offer. I have many issues, swelling, chronic inflammation. I take tart cherry, the joint health, the fish oil from another supplier, also zinc. Could you please cut it off?
Okay, so this is somebody struggling with the world we live in terms of the onslaught of oxidative stress and reactive oxygen species, and I get that. He's already taking a certain amount of supplements and medications, but he wants to do more and do better. But sadly, the healthcare system doesn't value natural medicine or prevention or health like this, so none of this is covered. And I know that, and that's difficult. The only way to get supplements covered is through a health savings account or a flex spend account, and usually you have to get a prescription for that. But some of them will support the use of supplements if you have a named condition like too much inflammation, too much oxidative stress. So I have patients that do it that way to be able to take everything they need to. But if you are like, you only have a certain budget for supplements, which is normal, the things you got to start with then is sleep and diet, to try to get what you can't get just through supplements. Nobody should be treating themselves with just supplements alone. You have to incorporate exercise, good sleep, diet, and controlling mental stress. So I'd say that probably the cheapest and easiest thing to do at first is meditation and box breathing or different ways to control mental stress. That should be done every day. And then try to get on a Mediterranean diet. If you have seed oils in your house, throw them out and get some good extra virgin olive oil. Yeah, seed oils include canola. That's made from rapeseed, and it's processed with hexane in high heat environment. So simple things like that. Meditate, box breathing. Try to get on a regular sleep schedule. Try to go to bed the same time every day and wake up the same time every morning. Try to time restrict your eating. When you do eat, try to eat the Mediterranean diet. No one's going to be perfect. You're still going to eat some bad food every now and then, and that's okay. But the more you start doing things better, the less often you will want to do the bad things, first of all. And then when you do eat bad things or do something like stay up late one night, it won't matter to your system quite as much. And then I think it sounds like you're on a good beginning for the supplements. Just really, like I said, make sure you've got a good antioxidant, which you do with the tart cherry, 2 or 3 antioxidants better, which you do with the joint health multi. And then I think everybody needs to be on magnesium, D3, and omega-3 because we're all deficient in this country of those micronutrients, which if you're on the connective tissue multi or the CBD multi, you're on those plus the omega-3. So I think the vitamin mix it sounds like you're on is pretty good. You just maybe need to get control of the sleep schedule, the mental stress, and then the diet needs to be worked on. And if you eat a good diet, you can eat as much food as you want and you'll be fine. what happens is you don't want to eat that much food because you're on a good diet and your brain's not getting hijacked by ultra processed foods.
Okay. We talked about this, but like how this is Sunshine, and she has Hashimoto's and fibromyalgia, and she's always fatigued. Just what are your thoughts?
Hashimoto's, a question about Hashimoto's and fibromyalgia and chronic fatigue. Both of those conditions will induce inflammation, and now we know probably your TNF alpha or one of your cytokines is upregulated, causing fatigue, and also you're probably not sleeping well with those two conditions. Fibromyalgia, we did a talk on that a while back. You may want to watch. I probably need to update it, but avoiding glutamate helps with fibromyalgia, so you can't eat anything with MSG or like soy products or anything like that, because glutamate is excitatory neurotransmitter and will upregulate people with sensory sensitization syndromes, which is what fibromyalgia is. Hashimoto's is just the thyroid behaving poorly. Thyroid health can be improved with like iodine to a certain degree. And then tyrosine, which we've talked about, and I've written some papers on this that are on the site. Tyrosine, which is an amino acid that's in our mindfulness set, but it's actually a precursor for thyroid hormone. So that's a way to support Hashimoto's. And then, of course, selenium from Brazil nuts. So even eating one Brazil nut a day can be helpful with that condition. But just trying to get regular sleep, again, just like the gentleman before, it matters for those conditions as well. So avoid glutamate, take tyrosine, and then you just need to be on a good, solid anti-inflammatory regimen, which is going to be like the Joint Health Multi, resveratrol, maybe the tart cherry extract.
Leslie, she was septic in 2018, and her SED rate level is on average 50 to 90. What natural medicine should she take?
Okay, somebody just asked a question about they were septic when?
In 2018.
In 2018, so years ago, and their SED rate's still between 50 and 90. So a normal SED rate should be like 3 or less. I would say if your SED rate's still 50 or 90, you may have an inflammatory autoimmune disorder that's undiagnosed. That is really very high, I think. Of course, it depends on your lab and the scale they use, but I would probably go get a workup and get like my high sensitivity CRP checked and things like that too. A SED rate that high I would get that worked up. I would go see somebody about that.
So, yeah.
All right, these are just some more products we have that are all designed to help combat the scourge of metabolic disease and chronic inflammation and oxidative stress. Pterostilbene is from blueberries. It's sort of like resveratrol, but maybe a little bit more biologically available for some. The delta-8 THC is amazing for reducing inflammation. Again, it's harnessing the endocannabinoid system, particularly good for neuropathic pain, I find, in my patients. The sleep gummies that we have all have tart cherry in it to help detox at night, particularly the brain. And GABA, which is a natural way to downregulate the excitatory neurotransmitters and help to induce sleep. I often add glycine, which is an amino acid, again, in our mindset series. Glycine directly counteracts glutamate. That actually might help the fibromyalgia person from before. And then chamomile, which is a well-known natural flower used for centuries to help sleep. Berberine is metformin effectively. It is a natural type of molecule that acts like metformin. So it affects the AMPK system in the cell to change the bioenergetics. So it'll help you maintain your glucose in the line it's supposed to be and not have massive spikes. So when people ask me what to do to control glucose and help with weight loss and stuff, I tell them to take berberine, take it with your most carb heavy meal. So whatever meal of the day you think is going to be the most carb heavy, I would definitely take berberine with that. You could take it with every meal, but then you'd have to, it starts to become a little bit more expensive. So at least one a day with a carb heavy meal. And then as we said before in this talk, it also downregulates COX-2 and will help control inflammation and make you feel better. Do what? Okay, we have more questions.
All right. So Sue, she's worried about blood thinning, so she takes the Tartary and the PEA, and she just wants confirmation that those aren't known to thin the blood, like turmeric.
Oh, so turmeric alone is not, this is a question for Sue asking if tart cherry and PEA thin blood like turmeric. Turmeric is just known to use the same enzyme in the liver that processes warfarin. So theoretically, if you're taking warfarin and you take turmeric at the same time, they can interact with each other. That's when turmeric got a bad rap for causing blood thinning. So tart cherry is not, I've never seen a literature report of any bleeding events from tart cherry extract, nor have I for PEA. All of these are in the food supply and found naturally, and they're generally recognized as safe. PEA is used as a first-line treatment in Europe for nerve pain, neuropathic conditions. So I personally, and I try to search for these things all the time, have not found any literature to that effect. But as with anything else, this is all for entertainment and information purposes only. You have to talk to your treating physician and go through the drug list you're on, see which liver enzymes being used, and will it mess with it. Generally speaking, I have never seen that, but I have to advise you to talk to your treating physician. But tart cherry extract is not known to dramatically reduce the clotting ability of platelets like, say, aspirin does.
This is Robert. You offer similar sleep products with and without CBD. Please discuss the process in choosing one of these. Remember, one has the melatonin.
Yeah, so one of the sleep gummies has melatonin, one doesn't. Some people don't respond well to melatonin and have a paradoxical reaction to it. So I made one without melatonin for that group of people. Or you don't need as much melatonin. Maybe you have really good sleep hygiene and you turn off all the lights in your house starting at 5. You turn on all the lights in the morning. You have really good oscillation of your melatonin with your cortisol. You may not need extra melatonin. Therefore, you have the other version, which doesn't have the melatonin. And has CBD. CBD, which is part of the endocannabinoid, well, it affects the endocannabinoid system. In other words, it binds the receptors in your body that are there for molecules that are dramatically similar. Actually, CBD upregulates the amount of anandamide, which is an innate molecule you produce, but it's normally broken down by this certain enzyme that CBD turns off. So you basically just get more anandamide, which is called the bliss molecule, when you take CBD. It's not doing anything else. It's not psychoactive. It doesn't get anybody high, but it does seem to really assist in sleep. And also, it's a very, very, very powerful antioxidant and anti-inflammatory. So if you believe that the body repairs itself at night while you're asleep, which I do, which most of the literature supports, then anything that helps it do that is beneficial. So that's why I take the sleep gummies, because I want to detoxify and help my brain heal itself every night. All right, I think we're done for today. Hopefully we will see you again in a month with our next topic, which is on bone health. All right, enjoy the rest of your February and happy Mardi Gras.